morning and welcome to another episode of Ask the Healthcare Advocate Live, where every Sunday morning I answer your questions about healthcare advocacy. And last week I wasn't here. It was Shavuot, right before the holiday. Became too complicated. A few minutes late this morning. Sorry, a bit of a delay. Trying to get back on track. Corona took a pause, then we had war, then we had riotings. Now that's kind of like slightly quiet. So anyway, trying to get back in the groove, and thought I would talk about a random question that actually had happened to me this week about mammographies and helping women get mammographies. I had a question from someone about they wanted to get a mammography in Shaarei Tzedek, and they made an appointment. They went and they couldn't get a hitchayvut, and they ended up paying privately, even though I know very, very clearly that Maccabi pays for mammographies in the Shaarei Tzedek breast clinic and will give a hitchayvut. So we were like, what's happening? So I thought that this would give a good beginning on just a review, who is eligible, etc. So in Israel, just to review, for those of you who might have missed it the first 55 times I've said this, but that mammographies are covered under the basket of services from age 50 to age 74. Bi-yearly, or is it bi-yearly, every 2 years? I always get those ones confused. But you can also often do it every year. It's not usually an issue. Inevitably, I say people, why does it stop after 74? Because as a screening method, it's no longer effective, and it's not usually as such of a concern for women over 74. Hence, anytime you have any kind of screening program, it's for, in general, the overall population, etc. The next question I get aren't mammographies dangerous? Whole other topic of discussion, but point just to be clear here is that right now they are the gold standard for being able to diagnose breast cancer at an early stage. The harm of having breast cancer outweighs the harm of doing the mammography from those ages. Hence the reason why mammography is still the recommended screening method of choice for women over 50, which brings me to the point, if you're from the United States, you are used to having mammography starting at age 40 or even earlier. No, that is not the protocol in Israel, unless you have one family history, meaning a mother, a father, aunt, first cousin, sister, etc., who's been diagnosed with breast or ovarian cancer, and or you are a breast cancer survivor, or there's some other reasoning, for example, that you are a BRCA1 or 2 carrier that would necessitate you having a mammography under age 50. Or the doctor recommended it because you did an ultrasound or a clinical breast exam and there was a strange finding and they want to do a mammography. Mammograms are not good screening tools for women who are still actively getting their period, and that is why they are not often used as a screening tool for breast cancer, because they're just hard to see. It's not that the doctor doesn't want to help you. It's not that the system wants you to get breast cancer. It doesn't care about you, both things I have heard, but rather it's just not an effective diagnostic tool. That being said, how do we get mammographies? Well, the Kupa, Yitcher Kupa, and most of you guys are in Maccabi and or Mu'chadet, they will give you either an appointment in the center that they use themselves, that's part of the Kupa, and then you have to make an appointment, and usually it's a couple months in advance, or they will give you a hitchayvut to see in a clinic that is not under the Kupa, but they will pay for it. It is very, very dependent on where you live geographically, hence the fact that you need to find out with the medical secretary. And I recommend a medical secretary in a large clinic, meaning not your local branch. Let's say you're in Maccabi and you're some area in, let's say take Jerusalem, for example, and you're Maccabi, let's say even on Derech Hebron, or you're in the new Maccabi, I would go to Agrippas because they are the center and they might know better than others where you can get a mammography through the Kupa. Now, interestingly enough, I've had several questions this week about Maccabi and mammograms and Jerusalem because Maccabi actually has an arrangement with the breast clinic center in Shaarei Tzedek, but it's sort of private, but it's inside of Shaarei Tzedek, as well as Machon Hala, which is in Givat Shaul, which are comprehensive breast care clinics. That means that you go in between 2 or 3 hours, you do a clinical breast exam, a mammography, and an ultrasound, and if needed, a needle biopsy, all at the same time. Having worked in this field of women's health for quite some time, going on, 25 years, I can tell you that for your peace of mind, as well as for good diagnostic practice, if you can go to a comprehensive breast clinic where they do everything at once, that is your better buy, as opposed to going to a place and having a mammogram and then waiting for the radiologist a few days later to look at it and then getting the answer and then often getting called back. And in between that time of the week and a half, and they call you back and the woman's basically like not eating because she's convinced she has breast cancer. And it just turns out that the picture wasn't great, the angle wasn't great, and the radiologist asked you to do it again. That's it. So instead of avoiding that, plus it's a one-stop shop. So meaning if the radiologist sees something at that moment, or the doctor feels something that is that seems suspicious, they can investigate it right there and then and sort of get to the bottom, and instead of having to go through 3 or 4 appointments that may take over a month to get accomplished. So that's why these one-stop shops are the best. And now Maccabi does offer those hitchayvut. You have to make the appointment through Maccabi, through the Merkaz Torim, and they do cover those. I've heard that the doctor says they do not. That is old news. Real news is, yes, they definitely have an scam with those places. Now, Muchedet, different story. Maccabi in other areas, each place is different with Maccabi, and that's why you have to check out. But if you live close to the Jerusalem area, or you live close to a place that does have a comprehensive breast clinic, ask if you can make an appointment and get a hitchayvut before you go to your local clinic. Muchedet, unfortunately, does not have that. Their default is one of their own clinics, not a one-stop shop. However, if you have any risk factors or you've got family history, you can push Muchedet to give you a hitchayvut for a comprehensive breast clinic, and not just underneath their own clinic. So those are things to remember. All right, 1 second, in the middle of a live here. So that's my take home for today. Feel free to, love to hear in the comments if you've had similar situations with any of your kupot and what you did about it. The message today is perseverance and making sure also that you get your mammographies when you're over age 50. And please always send me a line, ask me a question, always happy to answer. And join us next Sunday between 8:30 and 8:45, where we do our weekly episode of Ask the Healthcare Advocate Live. Thanks for joining.